Describe a time when you encountered a malfunctioning medical device during patient care. How did you handle the situation?
During my time working as a registered nurse in the emergency department, I encountered a malfunctioning infusion pump while administering intravenous fluids to a critically ill patient. The patient required rapid fluid resuscitation due to severe dehydration, and the pump suddenly began displaying error messages, stopping the infusion mid-treatment. Recognizing the urgency of the situation, I quickly assessed the problem, ensuring that it wasn't related to the 4-line or bag setup, which were intact. Realizing the issue was with the device itself, I immediately reverted to manual regulation of the 4 flow, calculating the correct drip rate to ensure the patient continued to receive the necessary fluids without delay. While maintaining manual control, I informed the charge nurse and the biomedical engineering team to troubleshoot the device. I stayed with the patient, closely monitoring their condition for any signs of deterioration, ensuring safety and continuity of care throughout. Once the engineering team confirmed the device malfunction, we replaced it with a functioning pump, resuming automated infusion. Throughout the incident, I maintained clear communication with both the patient and the attending physician, providing updates on the patient's status and steps being taken. This experience reinforced my ability to remain calm and think critically under pressure, as well as the importance of being adaptable in ensuring optimal patient care, even when technology fails.
What are your experiences with using electronic health records, EHRs? How have they impacted your workflow and patient care?
Throughout my nursing career, I have consistently used electronic health records, EHRs, across different healthcare settings, and they have significantly improved both my workflow and the quality of patient care. My experience includes working with various EHR systems like Epic and Cerner, which have streamlined the documentation process, enhanced communication among healthcare professionals, and improved access to patient information. EHRs have been instrumental in reducing the time spent on paperwork, allowing me to dedicate more attention to patient care. With a few clicks, I can review a patient's medical history, lab results, medications, and treatment plans, which ensures that I am fully informed when making clinical decisions. For example, when managing patients with chronic conditions, I can quickly review trends in their vital signs, lab work, and progress notes from other providers, leading to more coordinated and comprehensive care. This has helped in reducing medication errors, improving the accuracy of documentation, and ensuring that treatments are timely and appropriate. In terms of workflow, EHRs have made it easier to document patient interactions in real time, which improves accuracy and ensures that all relevant information is available to other members of the healthcare team. This has been particularly valuable in fast-paced environments like the emergency room, where timely and accurate information is critical to patient outcomes. I also appreciate how EHRs have built-in safety checks, such as drug interaction alerts and reminders for overdue tests, which further safeguard patient care. Overall, EHRs have made my work more efficient, improved communication, and positively impacted patient safety and care quality. While the initial learning curve can be steep, consistent use has proven to enhance the care process in both short and long-term patient management.
How do you stay up to date with the latest advancements in medical technology and devices?
Staying up to date with the latest advancements in medical technology and devices is essential for providing high-quality patient care, and I take several proactive steps to ensure I remain current. First, I regularly participate in professional development programs and attend workshops offered by my healthcare institution, which often cover new medical equipment and technologies. These sessions provide hands-on training and valuable insights into how new devices can be integrated into patient care. I am also an active member of nursing associations and organizations that offer continuous learning opportunities, such as online webinars, conferences, and certification courses. Through these platforms, I gain exposure to the latest trends and innovations in medical devices, such as advancements in telehealth, wearable monitoring devices, and automated infusion pumps, and learn best practices for incorporating them into clinical practice. For instance, I recently attended a webinar on smart infusion pumps, which enhanced my understanding of how these devices can prevent medication errors and improve patient safety. In addition to formal training, I make a point to stay informed by reading medical journals, research papers, and trusted online resources. Journals such as the Journal of Nursing Technology and the American Journal of Nursing provide in-depth reviews and studies on new devices, which help me critically assess their effectiveness and potential impact on patient care. Furthermore, I frequently consult the manufacturer's guidelines and updates for the medical devices I use daily, ensuring I am following the latest protocols and operating procedures. Collaboration with colleagues also plays a role in staying informed. I regularly exchange knowledge with fellow nurses, doctors, and biomedical engineers who have expertise in various devices. This not only helps me stay updated but also gives me practical insights into how different teams utilize technology to improve patient outcomes. By combining formal education, independent research, and collaborative learning, I ensure that I am always prepared to use the latest medical technologies effectively, enhancing both my skill set and the quality of care I provide.
What is your understanding of the importance of proper device handling and maintenance?
Proper handling and maintenance of medical devices are critical to ensuring patient safety, the accuracy of medical interventions, and the smooth functioning of healthcare operations. My understanding of its importance is rooted in the knowledge that medical devices, whether they are infusion pumps, ventilators, or monitoring systems, play a vital role in patient care. Any malfunction or improper use could lead to significant errors, delays in treatment, or even harm to the patient. First and foremost, adhering to proper handling guidelines minimizes the risk of device failure during critical moments of care. This includes following manufacturer instructions for use, regularly calibrating devices, and ensuring that they are in good working condition before each use. For example, when preparing an infusion pump for medication delivery, checking the device for proper calibration and function ensures accurate dosing, which is crucial for patient safety, especially in high-risk scenarios such as ICU settings. Device maintenance is equally important in prolonging the lifespan of equipment and preventing unexpected malfunctions. Regular inspections, timely servicing, and calibration checks not only ensure that devices operate within the required safety parameters but also help in detecting potential issues before they become major problems. By being diligent with maintenance, healthcare facilities can avoid costly repairs or replacements, as well as prevent equipment-related delays in patient care. Additionally, proper handling and maintenance play a significant role in infection control. Many medical devices come into direct contact with patients, such as catheters or respiratory equipment, and ensuring they are cleaned and disinfected according to protocol reduces the risk of hospital-acquired infections. In my practice, I am meticulous about following sterilization procedures and double-checking that reusable equipment is thoroughly sanitized before and after use. Ultimately, proper device handling and maintenance are key components of delivering safe, effective, and timely patient care. By ensuring that devices are functioning correctly and are well maintained, healthcare professionals can minimize the risk of errors, improve patient outcomes, and maintain the trust and confidence of both patients and the broader healthcare team.
How do you ensure the safety and effectiveness of medical devices in your practice?
Ensuring the safety and effectiveness of medical devices in my practice involves a combination of vigilance, adherence to protocols, and continuous education. The first step is performing a thorough inspection of any medical device before use, verifying that it is in good working condition and properly calibrated. For instance, with infusion pumps or patient monitors, I always check for signs of wear, malfunction alerts, and whether the device is displaying accurate information before using it in patient care. By doing this, I can prevent the use of faulty equipment that could compromise patient safety. I also strictly adhere to manufacturer guidelines and institutional protocols when operating medical devices. Each device has specific instructions that dictate how it should be used for maximum effectiveness and safety. I take care to follow these instructions meticulously, whether it's setting up ventilators or operating diagnostic equipment, ensuring that each step is performed correctly. Additionally, I regularly review hospital policies related to device handling, which often include updates on best practices or newly implemented safety procedures. Another important part of ensuring safety and effectiveness is routine maintenance and calibration. In my practice, I work closely with the biomedical engineering team to ensure that all medical devices undergo regular servicing and calibration checks. This process is essential for detecting and addressing any potential issues that may not be immediately visible during daily use. For instance, if an IV pump is not calibrated correctly, it could deliver an inaccurate dosage of medication, so periodic checks ensure that all settings are precise. I also prioritize proper training and continual education for both myself and my colleagues. Whenever a new device is introduced, I make sure to attend any relevant training sessions to fully understand its functionality and safety features. In fast-paced environments like the emergency room, where devices are often used under pressure, having up-to-date knowledge and proficiency ensures that the equipment is used correctly and safely. In addition, I engage with manufacturer-provided resources, such as manuals and troubleshooting guides, to remain informed about best practices for device operation. Finally, I continuously monitor patients when devices are in use, watching for any signs of malfunction or adverse reactions. If I detect any issues, such as unexpected alarms or changes in device performance, I act immediately by either adjusting the device or discontinuing its use until it can be inspected. My focus is always on maintaining patient safety, and by being proactive in device monitoring, I can quickly address any concerns that arise during care. Through consistent inspection, adherence to guidelines, ongoing training, and real-time patient monitoring, I ensure that the medical devices I use in my practice are safe and effective, ultimately contributing to better patient outcomes.
Can you explain the process of inserting a nasogastric tube? What precautions do you take to prevent complications?
Inserting a nasogastric (NG) tube is a common but delicate procedure that requires precision and careful attention to prevent complications. The process begins with proper patient preparation, including explaining the procedure to the patient to reduce anxiety, ensuring that they are in a high Fowler's position, sitting upright at about a 45-90 degree angle, and verifying that there are no contraindications such as facial trauma or recent nasal surgeries. Before inserting the tube, I measure the correct length of the NG tube by placing the tip at the patient's nostril, extending it to the earlobe, and then down to the xiphoid process. This ensures the tube reaches the stomach. Once measured, I mark the tube and lubricate the distal tip with water-soluble lubricant to make insertion easier and more comfortable for the patient. During the insertion, I gently insert the tube into the nostril and ask the patient to tilt their head forward, which helps close the airway and direct the tube into the esophagus rather than the trachea. I encourage the patient to swallow or sip water as I advance the tube, which facilitates passage through the esophagus and reduces the risk of entering the airway. Once the tube reaches the predetermined mark, I check its placement to ensure it has entered the stomach. The primary verification method is aspirating gastric contents and checking the pH, which should be acidic, usually between 1 and 5. I also confirm placement by listening for air sounds over the stomach using a stethoscope while injecting air into the tube. However, to be completely certain, an X-ray may be ordered to verify correct positioning, especially in more critical cases. Throughout the procedure, I take several precautions to prevent complications. One of the most important is ensuring that the tube does not enter the airway. Continuous monitoring of the patient's response during the insertion is key. If the patient experiences coughing, choking, or significant distress, I stop the procedure and reassess, as these can be signs that the tube has entered the trachea. In addition, I monitor for signs of nasal trauma or bleeding, which can occur if the tube is inserted too forcefully or incorrectly. Post-insertion, I ensure that the tube is securely taped to prevent dislodgement, and I continuously monitor the patient for signs of aspiration, abdominal distension, or discomfort, which could indicate improper placement or feeding issues. Regular assessment of the tube's position is also crucial, especially in patients who are active or agitated, to prevent migration of the tube into the airway or small intestine. By adhering to these steps and precautions, I help minimize the risk of complications such as aspiration, misplacement, or nasal trauma, ensuring the safe and effective use of the nasogastric tube for feeding or gastric decompression.
Describe your experience with using infusion pumps. How do you ensure accurate medication delivery and prevent errors?
I have extensive experience using infusion pumps across various clinical settings, including emergency rooms and intensive care units, where precise medication delivery is critical. Infusion pumps are essential for administering fluids, medications, and nutrients accurately and consistently, especially when working with patients who require controlled doses over extended periods. To ensure accurate medication delivery and prevent errors, I follow a strict protocol, starting with a thorough assessment of the pump and the medication to be delivered. Before initiating an infusion, I double-check the physician's order for the correct medication, dosage, rate of infusion, and patient's details. I also ensure that the medication is compatible with the intravenous fluids, if any, to prevent interactions that could affect the treatment or cause harm. When programming the infusion pump, I am meticulous in entering the correct rate, volume, and time as prescribed. Many pumps have safety features like dose error reduction systems, DERS, that alert the user if parameters are outside of the safe range, and I always rely on these features to double-check my input. Even with these safeguards, I perform my own verification to ensure that the correct data is entered, as small errors can have significant consequences, especially with high-risk medications like insulin, chemotherapy agents, or opioids. Regular monitoring is another key aspect of preventing errors. Once the infusion is running, I routinely check the pump to ensure that the infusion is proceeding as expected. This includes verifying that the foresight is intact and that there are no signs of infiltration, occlusion, or leakage, which could affect the medication delivery. If the pump issues an alarm, I address it immediately to determine whether the issue is with the pump, the tubing, or the patient's foresight, and take the necessary corrective actions. In addition, I pay close attention to the patient's response to the medication. For example, when administering medications like vasopressors or pain management drugs, I closely monitor the patient's vital signs and overall condition to detect any adverse reactions or signs of over- or underdosage, which may indicate an issue with the infusion. Another critical aspect of ensuring safe medication delivery is proper documentation. I document the start time, dosage, rate, and any patient responses in the electronic health record, EHR, ensuring that all members of the healthcare team have an accurate and up-to-date understanding of the patient's medication regimen. This also allows for seamless handover during shift changes, reducing the risk of errors due to miscommunication. Lastly, I undergo regular training to stay up to date with the latest infusion pump technology and safety protocols. Newer models often come with advanced safety features, and staying informed about these developments helps me use them effectively to improve patient safety. Through careful programming, ongoing monitoring, adherence to safety protocols, and continual education, I ensure the accurate and safe use of infusion pumps, minimizing the risk of medication errors and improving patient outcomes.
What safety measures do you follow when using a defibrillator?
When using a defibrillator, I follow strict safety protocols to ensure both patient safety and the safety of the healthcare team. The use of a defibrillator is often in urgent, life-threatening situations, such as during cardiac arrest, so it is critical to act swiftly and correctly. First, I begin by assessing the patient to confirm the need for defibrillation. I ensure that the patient is unresponsive, not breathing, and lacks a pulse. If these signs of cardiac arrest are present, I immediately initiate the defibrillator setup. Depending on the type of device, whether an automated external defibrillator, AED, or a manual defibrillator, slightly different steps are required, but the core safety principles remain the same. One of the most important safety measures is ensuring that no one is in physical contact with the patient or the bed during defibrillation. Before delivering a shock, I clearly announce "clear" to the team and visually confirm that no one, including myself, is touching the patient. This prevents accidental electrocution. I double-check that any equipment in direct contact with the patient, such as 4 lines or oxygen masks, is properly placed to avoid interference with the defibrillation. For manual defibrillation, I select the appropriate energy level based on the patient's condition and the type of arrhythmia detected, such as ventricular fibrillation or pulseless ventricular tachycardia. I follow my institution's resuscitation protocols or Advanced Cardiac Life Support, ACLS, guidelines to ensure the correct jowls are used. When using an AED, I ensure the machine analyzes the heart rhythm and advises a shock only if necessary. For both types of defibrillators, I ensure proper pad placement. Typically one pad is placed on the right upper chest and the other on the left lower chest, so that the electrical current passes through the heart effectively. Proper pad or paddle placement is critical to achieving effective defibrillation while minimizing the risk of burns or injury to the patient. I always ensure the skin is dry and, if necessary, remove any chest hair to promote good adhesion of the pads or paddles. If the patient has a pacemaker or any metal implants, I make sure to place the pads away from these devices to avoid damaging them or causing unnecessary injury. After administering the shock, I immediately assess the patient's heart rhythm and vital signs to determine if the shock was effective or if further action, such as another shock or resuming chest compressions, is needed. Throughout the resuscitation process, I closely follow ACLS protocols to ensure the patient receives appropriate care based on their condition. In addition, I regularly inspect and test the defibrillator as part of routine equipment maintenance to ensure it is always functioning correctly. This includes checking the battery life, ensuring the pads or paddles are in good condition, and confirming that all accessories are properly stocked for emergency use. By following these safety measures, verifying the need for defibrillation, ensuring no physical contact during shocks, placing pads correctly, using the right energy levels, and regularly maintaining the equipment, I can effectively use a defibrillator while minimizing risks to both the patient and the healthcare team.
Describe your experience with using a ventilator. What are the key settings and parameters to monitor?
I have significant experience using ventilators in critical care settings, particularly in the intensive care unit, ICU, and emergency department, where patients often require mechanical ventilation due to respiratory failure or other life-threatening conditions. Ventilator management is a vital part of patient care in these settings, and it requires careful attention to ensure that the patient is receiving adequate respiratory support while minimizing the risk of complications. When setting up a ventilator, I collaborate with the medical team, particularly the respiratory therapists and physicians, to ensure that the ventilator settings are appropriate for the patient's condition. The key settings and parameters that I monitor closely include: 1. Tidal volume, VT. This is the amount of air delivered to the patient with each breath. It is typically based on the patient's ideal body weight to prevent lung injury from overdistension. For most patients, the recommended tidal volume is between 6 to 8 milliliters per kilogram of ideal body weight. Monitoring this setting helps ensure that the lungs are neither overinflated nor underinflated, which could lead to barotrauma or atelectasis. 2. Respiratory rate, RR. This is the number of breaths the ventilator delivers per minute. The rate is adjusted depending on the patient's underlying condition, such as acute respiratory distress syndrome, ARDS, or chronic obstructive pulmonary disease, COPD, to ensure optimal gas exchange. I continuously monitor this to ensure the patient maintains an appropriate balance between oxygenation and carbon dioxide removal. 3. Fraction of inspired oxygen, FiO2. This represents the concentration of oxygen being delivered to the patient. The goal is to provide enough oxygen to maintain adequate oxygen saturation, usually above 92%, while avoiding oxygen toxicity. FiO2 is adjusted based on the patient's oxygenation status, as indicated by pulse oximetry or arterial blood gases, ABGs. Monitoring FiO2 is essential, especially in critically ill patients who may require high oxygen levels but are at risk of oxygen-related lung injury. 4. Positive end expiratory pressure, PEEP. PEEP keeps the alveoli open at the end of exhalation, improving oxygenation and preventing alveolar collapse. In most cases, a PEEP of 5 cm H2O is used as a baseline, but higher levels may be necessary in patients with conditions like ARDS. I closely monitor the effects of PEEP on oxygenation and hemodynamics, as excessive PEEP can impair venous return, leading to hypotension or other cardiovascular issues. 5. Peak inspiratory pressure, PIP. PIP is the highest pressure reached during inhalation and reflects the resistance in the airways and the compliance of the lungs. High PIP values can indicate issues like airway obstruction, mucus plugging, or poor lung compliance. By monitoring PIP, I can help detect problems early and prevent complications such as barotrauma. 6. Plateau pressure. This is another critical parameter, especially in patients with ARDS. It reflects the pressure in the lungs after inhalation when airflow has stopped, and it helps assess lung compliance. Keeping plateau pressures below 30 cm H2O is important to minimize the risk of ventilator-induced lung injury. 7. Minute ventilation, VE. This is the total volume of air moved in and out of the lungs per minute, calculated as tidal volume multiplied by respiratory rate. Monitoring minute ventilation is crucial for ensuring that the patient's ventilation needs are met, particularly in cases of hypercapnia, elevated CO2, or hyperventilation. In addition to these settings, I continuously assess the patient's overall condition and response to ventilation. This includes monitoring oxygen saturation, SpO2, capnography for end-tidal CO2, and performing regular arterial blood gas, ABG, analysis to assess oxygenation, ventilation, and acid-base status. I also observe the patient for signs of respiratory distress, such as increased work of breathing, and adjust the ventilator settings as needed in collaboration with the medical team. Close attention is paid to ventilator alarms, which can signal issues such as disconnections, obstructions, or changes in patient condition. Addressing these alarms promptly is critical for patient safety. Finally, I regularly assess potential complications of mechanical ventilation, such as ventilator-associated pneumonia, VAP, barotrauma, or hemodynamic instability, and take preventive measures like proper positioning, oral care, and ensuring the patient's readiness for weaning when appropriate. By monitoring these key settings and maintaining a comprehensive approach to patient care, I ensure that the ventilator is providing effective support while minimizing the risk of complications.
How do you ensure accurate readings from a blood pressure monitor?
Ensuring accurate readings from a blood pressure monitor is essential for proper patient assessment and management. To guarantee accurate results, I follow a series of best practices, starting with the proper selection and application of the blood pressure cuff, as well as correct patient positioning. First, I ensure that the blood pressure cuff is the appropriate size for the patient. The cuff should cover about 80% of the patient's upper arm and fit snugly without being too tight or too loose. A cuff that is too small can result in falsely high readings, while a cuff that is too large can give inaccurately low readings. I also position the cuff correctly, placing it around the upper arm, about 2 to 3 centimeters above the antecubital fossa, with the bladder of the cuff centered over the brachial artery. Patient positioning is another crucial factor for accurate readings. I make sure the patient is seated comfortably with their back supported, feet flat on the floor, and legs uncrossed. The arm being used for the measurement should be at heart level, resting on a flat surface. If the arm is too high or too low, it can affect the reading. If the patient is lying down, I position their arm at the same level as their heart to ensure an accurate measurement. Before taking the blood pressure, I ensure the patient is calm and has had a few minutes to rest. Physical activity, anxiety, or recent consumption of caffeine or nicotine can raise blood pressure, leading to inaccurate readings. I typically wait at least 5 minutes after these activities before taking a measurement. When taking the measurement, I avoid talking to the patient or allowing them to move, as these can interfere with the reading. I also take multiple readings, typically 2 or more, with at least 1 minute between them, and use the average of these readings to provide a more reliable result. If I notice a significant difference between readings, I investigate further to determine the cause. If I'm using an automatic blood pressure monitor, I ensure that it is calibrated regularly according to manufacturer guidelines to maintain accuracy. For manual measurements, I use a well-functioning, calibrated sphygmomanometer and stethoscope, making sure to properly locate the brachial artery before inflating the cuff. I listen carefully for the Korotkoff sounds, noting the systolic and diastolic pressures accurately. In addition, I always consider the context of the reading, taking into account the patient's baseline blood pressure, current condition, and any factors that may influence the result, such as medications or pre-existing conditions. If a reading seems abnormal, I repeat the measurement, check the equipment, and assess other clinical signs before drawing conclusions. By following these steps, using the correct cuff size, ensuring proper patient positioning, waiting for the patient to rest, taking multiple readings, and ensuring the equipment is calibrated, I help ensure that blood pressure readings are accurate, leading to better patient assessment and care.